got a 776 today on my HESI, and I'm calling it a win, to be honest. All right. So I'm going to give you a couple tips that's going to increase your score the next time you retest. All right. First of all, you need to remember when it comes to these exams, such as HESI, such as ATI, these tests are based mainly on three things. It's going to be priority and delegation, it's going to be the nursing process, and it's going to be Maslow's hierarchy of needs. You need to keep that in mind. As soon as they give you scrap sheet of paper to write things down, write those three things down first. So whenever you're confused, go back to those three things and look to see what kind of question you're being asked, right? If you're being asked priority delegation question, which patient are you going to assess first? Which patient takes priority? I'm telling you right now, any patient that has a change in or alteration in their mental status, for the worse, an alteration in their behavior, for the worse, any patient that has an infection that's also immunocompromised, any patient that's showing signs and symptoms of hemorrhage, any patient that's had surgery and we're seeing signs and symptoms of infection, hemorrhage, or DVT pulmonary embolism, any patient that has VTAC, AFib, VFib, any patient that's hypoglycemic. When you see those type of patients, I'm telling you right now, they're going to be a priority. Why did I say hypoglycemia and not hyperglycemia? Because hypoglycemia will kill you a lot faster, right? When you're hyperglycemic, your blood sugar's high, you have all of these mechanisms to try to survive. Your body's going to try to compensate. You're going to have polyuria. You're going to be urinating all over the place trying to get rid of all that sugar, right? You're going to have polydipsia. You're going to have that excessive thirst where you're going to keep wanting to drink water to dilute all that sugar. You're going to have polyphagia where you have that excessive hunger because even though you have all that sugar, the sugar's stuck in the blood and it can't do anything in the blood. By the way, don't worry about me looking like a chipmunk. I just had 2 teeth extracted, so my face is kind of puffy. But anyway, you have all of these mechanisms to try to help you. But if you're hypoglycemic, by the way, blood sugar 7110, right? So your blood sugar is lower than 70, boom, you're on the ground, right? So any patient, and ATI and HESI, they're fair. So they're going to tell you this is a known diabetic. They're insulin dependent. Then they're going to give you signs and symptoms such as, irritation, agitation, confusion, things like that. You better suspect hypoglycemia. That's the patient you're going to be running to. Those types of patients are always going to be priority patients. Patients is having difficulty breathing. Here's the problem. The minute you see difficulty breathing, you see shortness of breath, you want to run to it, right? But you have to look at it in the context of the situation. So for example, if you have a patient that has a history of cystic fibrosis, they have a history of CHF, they have a history of COPD, emphysema, bronchitis, and they're having mild MILD, mild shortness of breath or dyspnea with exertion, why are we running to them first? Is it that expected with that disease process? Of course it is. I don't even have any of those disease processes, and I do any exertion. Guess what? I'm gonna have a little shortness of breath myself, right? The patient that we're going to be running to is the one that has moderate or severe shortness of breath, difficulty breathing, whether they have an underlying cause or not. So it's those little differences, guys. If you tweak that, you're going to do so much better on your exams. Maslow hierarchy of needs. What's most important? Physiological integrity. What is freaking keeping your patient alive? What am I talking about? Abnormal vital signs, fluid and electrolytes, nutrition, glucose, airway, breathing, circulation, hemodynamic status, seizures, chest pain, and not specifically the chest pain, but it's what the chest pain represents. It can possibly be a myocardial reaction. I get excited. I speak too quickly. It can possibly be a myocardial infarction, right? So until it's ruled out, it's going to be a priority, right? You're going to have to get that EKG done, figure out what's going on with the patient because, it might be GERD. But guess what? In nursing, we never assume. Patient has chest pain. You're going to assume the worst. You're going to assess that patient first, right? Those little things make such a big difference. Last is nursing process. So you look at the question and see where you are in the question. If you just administered a medication, you just performed a nursing intervention, what you're going to do next is evaluation. You want to see if it works. So if you gave insulin, right, you're going to evaluate your patient, assess your patient, take that patient's glucose and see if it dropped. You also want to make sure you didn't overcorrect the problem because we give a patient insulin, we may overcorrect the problem and cause them to have a hypoglycemic reaction. That's why it's so important after you perform a nursing intervention to evaluate, right? But if you get a question and in the question they tell you something's wrong with your patient, What are you going to do? Assess. The minute something's wrong with your patient, you have to assess. You have to get information. Assessment may be a physical assessment. You're checking them out physically, or it could be going into the patient's chart to look up information, see what kind of drugs the patient's on, or even asking a question to the patient or a caregiver. That is considered an assessment. So you really have to look at the question, see where you are in the question to figure out what your next action is going to be. I promise, if you don't do those 3 things, you're going to see your score on both ATI and HESI increase dramatically. Don't say I didn't warn you.